Helicobacter pylori Natural Treatment Protocol. Follow this Helicobacter pylori natural treatment plan to get rid of this common stomach infection. Helicobacter pylori. Helicobacter pylori can cause a wide range of problems, from chronic gastritis, peptic ulcer disease, iron deficiency anemia, and stomach cancer to diseases of the liver, cardiovascular system, skin, and many other body systems. If you suffer from this infection, an Helicobacter pylori natural treatment plan can be a safe solution. Helicobacter pylori infection is closely linked to coronary heart disease, rosacea, asthma, Parkinson's disease, migraines, and fibromyalgia. Testing for Helicobacter pylori can be done through multiple avenues, including a blood test to check for the presence of H. pylori antibodies, a breath test, or a stool antigen test to check for Helicobacter pylori in stool samples. If you are at risk for ulcers or stomach cancer, you'll want to know how to utilize H. pylori natural treatment options. Helicobacter pylori natural treatment. Treatment for Helicobacter pylori can take both a conventional and natural path. Helicobacter pylori natural treatment can not only help eradicate Helicobacter pylori infection, but also reduce inflammation of the stomach lining and even help prevent the risk of stomach cancer. Probiotics are beneficial bacteria that help to maintain the health of the intestinal tract, aid in digestion, and help keep potentially harmful organisms in the gut, such as H. pylori, under control. Many studies have demonstrated that probiotics, including Saccharomyces boulardii and Lactobacillus and Bifidobacterium species, are a useful H. pylori natural treatment. Although some studies have reported that probiotics alone are an effective H. pylori natural treatment, they may be more useful when used as a supplemental therapy along with either conventional or natural antimicrobial drugs or herbs. Most studies have looked at probiotics in conjunction with standard conventional drug treatment. Researchers recently analyzed the results of 21 studies involving thousands of participants, concluding that supplementing with probiotics along with standard therapy significantly improves the cure rates and reduces the risk of antibiotic-associated side effects. Whether you are treated with conventional medications or not, the addition of a probiotic supplement both during and after your H. pylori eradication treatment is recommended. The ideal dose depends on the type of probiotic used. Generally, at least 10 to 20 billion CFUs per day is recommended, away from antibiotics and oral antimicrobials. N-acetylcysteine, NAC, is a natural antioxidant and mucus-dissolving nutrient that destroys the biofilm of H. pylori. Helicobacter pylori's biofilm is what helps it to survive in the stomach and resist antibiotic treatment. Like probiotics, NAC supplementation has been shown to help treat Helicobacter pylori infection and overcome antibiotic resistance. A typical recommended dose is 600 mg 3 times daily between meals. Herbal extracts and phytonutrients, many with antibacterial actions, are often used by natural practitioners to help eradicate H. pylori. Some researched herbal extracts shown to be effective against Helicobacter pylori include a glycyrrhizated licorice extract, DGL, ginger root extract, garlic extract, capsaicin, from red peppers, sulforaphane, from Bassica family plants like broccoli sprouts, red ginseng extract, epigallocatechin gallate, one of the green tea catechins, red wine extract and resveratrol, quercetin, a flavonoid, vitamin C, vitamin E, and selenium supplementation will help lower your risk of dying from stomach or esophageal cancer after H. pylori infection has been treated. This combination of antioxidant nutrients was studied in a large placebo-controlled trial involving thousands of people with H. pylori. Patients received vitamin C, 250 mg, vitamin E, 100 IU as alpha-tocopherol, and selenium from yeast, 37, 5G, or placebo, taken twice daily for 7,5 years after their original Helicobacter pylori infections were treated with standard drugs, omeprazole and amoxicillin. The researchers then followed up with the patients after another 7 years. The long-term antioxidant supplementation was statistically significantly associated with reduced death from stomach and esophageal cancer. A good quality, high-potency multivitamin and mineral supplement should provide vitamin C, vitamin E, and selenium in amounts close to those used in the study above, although you may need to supplement with extra vitamin C to reach the full daily dose of 500 mg. Conventional Helicobacter pylori treatment. The standard conventional treatment is referred to as triple therapy. It consists of a proton pump inhibitor, PPI, along with 2 antibiotics, clarithromycin and amoxicillin. Quadruple therapy with 3 antibiotics is also used. However, even quadruple therapy is no longer efficacious in many cases because of rampant antibiotic resistance. The standard drugs used also cause many side effects, including bloating, diarrhea, and taste disturbances. The side effects often lead patients to fail to take the full course of antibiotics as prescribed, further reducing effectiveness. Helicobacter pylori natural treatment. What to try first? If you've been diagnosed with Helicobacter pylori infection, you have the option of trying Helicobacter pylori natural treatment in place of, or in conjunction with, standard drug treatment. Whether it's best to use an all-natural approach or to use natural therapies alongside conventional ones will depend, in part, on how much damage has already occurred to the stomach lining. If your Helicobacter pylori infection is mild and the damage is minimal, starting with an all-natural approach makes sense. While there are many different Helicobacter pylori natural treatment options, here's a recommended protocol based on the natural remedies discussed above. Probiotic, such as Prematophilus optima by Nature's Way, containing 35 billion CFUs per capsule. Take 1 capsule twice daily for 1 month, then 1 capsule per day for 2 additional months. N-acetylcysteine, NAC, 600 mg 3 times daily between meals for 3 months. Deglycyrrhizinated licorice, DGL, such as DGL by enzymatic therapy. Chew 2 tablets, 760 mg, 20 minutes before each meal for 3 months. Garlic extract, such as Kyolic Reserve aged garlic extract. Take 1 tablet, 600 mg, twice daily with meals for 3 months. In addition to the supplements above, take a multivitamin and eat the following foods as often as possible: fermented foods, such as yogurt, sauerkraut, and kimchi. High phytonutrient foods, such as green tea, ginger, turmeric, and berries, and broccoli sprouts. Share your Helicobacter pylori treatment experience. Have you treated an Helicobacter pylori infection with natural medicine? Please share your experience so others who are interested in national health can learn from you.